North Texas hospitals and emergency rooms are seeing more illnesses related to COVID infections and with other respiratory illnesses like flu and RSV spreading as well. It could be kind of challenging to stay healthy this fall. Let's go to Fox 4's Alex Boyer in studio. Alex.
Hi, Heather. Well, these new COVID cases are on the rise, and doctors say that patients are coming in with some pretty bad symptoms. Now, the state just released some new data showing COVID cases going in the wrong direction, but a new vaccine may help curb the spread. At Citra Urgent Care in Dallas,
just saying a lot more of the upper respiratory.
much of the conversation is centered around COVID again. Dr. Nick Carr says approximately 15 to 20% of patients seeking care at one of his 7 DFW locations are testing positive for COVID-19.
Definitely seen an uptick in patients coming in with COVID symptoms, so a lot of sore throats, cough, headache, and sicker than we've been seeing over the past, let's say, 6 months.
Dr. Carr says he's concerned even more people could be infected with COVID and not even know it based on conversations he's had with his patients.
They came in because they're like, I don't know what's going on. I took a home test and it's negative, and sure enough, when we test them here, they, a good number of them end up testing positive.
Carr believes the at-home test may no longer be able to accurately detect these ever-evolving variants. The DFW Hospital Council is keeping a close eye on COVID cases too.
So you can see in the last 6 to 8 weeks, we've continually had an uptick.
The state reported more than 26,000 new cases last week. That's up nearly 32% from the week before. And the average number of people hospitalized rose to nearly 1,200 from nearly 1,100 the week before.
Of the ones that we've seen here in North Texas and really throughout the state, it's really been a derivative of Omicron.
37 deaths were associated with COVID last week, up from 19 the week before. Still, Stephen Love is optimistic with what's coming down the pipeline.
We're also excited about this new vaccine that's going to hopefully come out within the next 3 to 4 weeks that will hopefully curtail some of the spread.
In the meantime, you may notice a return to masking in many public settings. Dr. Carr's staff is doing it not just for COVID, but for RSV and flu season, also in bloom.
COVID's going to be here for the foreseeable future.
And Stephen Love with the DFW Hospital Council says it will be interesting to watch the next 10 to 14 days after Labor Day with people who traveled and everyone getting together for the holiday. Will that lead to further uptick in COVID cases? Heather, time will tell.
And we will watch. Alex, thank you.